I'm Robyn Littlewood again, corrective exercise specialist, and today we're going to be working on lower back pain. So we're going to start with the usual suspects. I'm going to start on the back of the body, and I'm going to start down at the calves. And it may seem strange that calves would be involved in your lower back, but typically lower back pain is coming from some sort of either a pronation or a supination or an inward turn or an outward turn of your feet, which will affect these muscles. So if you don't have shoulder issues, we're going to take you up on the roller and look along those big muscles in the calf. And again, when you find something in there that hurts, on me it's right there, I just stay on that until the trigger point lets go. Going to keep looking around in there. Now, if you're a beginner to this, or if you're maybe a little bit overweight, or you have shoulder problems and you can't hold yourself up like this, just take the weight of your opposite leg and look around in here for lumps, trigger points, and release that muscle tissue from your ligaments. And let's do that on both sides. So this is releasing the muscle or the myo from the fascia. There's a good one. And you'll have areas that you always find trigger points in. I'm obviously doing this a lot, so I'm pretty good, but I'm also extremely active, and I do a lot of weightlifting. So I usually find some good trigger points after a good weight workout, usually the next day or maybe even 2 days later. So I'm just looking around in there, and you can see there's a trigger point there that's kind of like a mouse running around underneath my skin. And I have such good trigger points there that I don't even need to lift myself up. So and then I'm going to move up to the hamstring. This, I like you to bring your tube out so that you're only using one leg. And if you have anything going on in your hamstring, it's going to be right here where it attaches to your pelvic girdle. So we're going to take a look around in there, see if you can find something where the hamstring's attached to your pelvic girdle, right in here. This is attachment number 1. And then I'm going to use my knee to sort of push myself back and see if I can get to the second attachment, which is right there. And just any trigger points that you can find in here. This one's a little bit more challenging, the hamstring. And I like to do it one-legged like this. You'll see people doing it this way, but I just find that I can't get enough body weight on there for that, really for that to help me. So I move it out and then use the knee to maneuver. Now, if you don't have a bad knee, a really easy way to do it is the hurdler stretch. You got a bad knee, don't do that. And I'm just looking around in there for stuff that hurts. Okay, and this stuff all pulls on the lower back. And now I'm going to move up into the piriformis muscle, which I call your figuriformis. Because whenever you're in a 4 position, so I'm going to take my right leg over my left, I look like a 4, and I'm going to go to the right. So I'm looking in between the SI joint, or just above my tailbone, right under here. It's underneath that big muscle, the glute maximus. That's your biggest muscle. So you're exposing it a little bit when you do this. And if you find something in here that hurts, that's what your problem is. That's what's causing your lower back pain. This is probably the culprit. Sciatic pain is also caused by this because the sciatic nerve innervates your piriformis. And your piriformis is a short, thick muscle that attaches just above your tailbone and comes all the way out here. And then I'm going to go a little higher onto my glute medius. And if you're very mobile, you can add something here. I'm looking around. This one's a little bit more challenging. I'm looking around in there in that glute medius because I know that I've got stuff going on in there. And if you can't do that yet, just work on this. And then you move over to the left side. So I'm going to look like a 4 on my left. It's my left side figuriformis. And I'm gonna find something over here probably. If you are substantially worse on one side than the other, that means you probably got an asymmetrical weight shift, and that will cause lots of problems. So you definitely want to do this. Okay, and again, you're looking for stuff that hurts. So we did the piriformis, hamstring, and calves. Now I'm going to move over to the adductor again. I'm going to face you so that you guys can see that the tube is vertical to me. And you want to be in a plank position. So I'm going to bend that right knee and put as much weight on there as I can. And if you're looking at lower back problems, you're probably going to find something up in here. I'm rolling just inside my hip as well. That's your psoas muscle. And we're going to come down that adductor. So if you're doing this roll, this is what people usually do that's wrong. They sort of do something like this. So I want you to get in a plank position so that you can get right in there, and then you have to sort of scoot out this way to roll to your knee. So we're rolling the adductor, and you're going to do that on both sides. And last but not least is everybody's favorite, the iliotibial band. And if you're new to rolling, the black roller is the hardest roller. So if you really can't take it, you could get the blue roller. And this one just has more give in it, and it won't hurt as much. But only if you can really, if you can't do black, because this one is not as effective. But if you're a beginner or maybe you're over 75, you may have to go with that option if this is just too painful, because if it's too painful, you won't do it. Or you could start with the softer roller and move up. So again, do not do this if you have a hip replacement too high. You have to stay in between the replacement. I'm going to take that down to the knee, and I'm going to roll all the way down the outside along the side of my leg. And if you've got pain along here, again, that's probably the most common cause of lower back pain, because it attaches to your hip and to your tibia, which is your shin bone. So it will pull the whole body out of alignment. So you want to try to get as many trigger points in there as you can. And again, I'm using my arm and shoulder here, so if don't overdo it if you have bad neck and shoulders, because you may cause yourself more neck and shoulder pain trying to fix your lower back, which would be silly. So that was your rolling for the lower back.